Childcare is an activity in Kajiado where is mostly and strongly carried out by the women. Men also participate, but somehow from a distance. Not all of them are so close. But when we come to urban, at least you'll see a lot of men involvement in childcare.
The child is the child, whether they're in Kajiado, whether in Nairobi, whether they are which part of the country. But the child in Kajiado has some experiences that other children may not have. You know, that's where we have the drought. You know, that's where we also have issues of people moving from one place to another, looking for pasture. So the child care in Kajiado is different from the child care in Nairobi.
For Kajiado County, I still feel that we have a lot of space, especially when we have to come up with childcare facilities. The space is quite sufficient. But in Nairobi, especially in the slums areas of Korokosho, you know, Lunga Lunga areas, I still feel that the environment that we're raising our kids in is totally different with the one in Kajiado.
First CAP CCD project, what we wanted to achieve is to get a deeper understanding of caregiving practices among nomadic pastoralists. We wanted to know what childcare practices families were engaging in, and we also wanted to find out the status of children in terms of their nutrition and developmental status. And what we found is that caregiving was mainly provided by female members of the family. The other thing that was noted is that children in this area seemed to have a very poor nutritional status.
The urban setup, the area around Kitengela, is not very far from what we have in Nairobi. The place is a bit more formal, structured, good hand washing practices were observed, a nice play area. But now moving to the rural areas, there are various things that we observed. For instance, the issue of the grandparents taking care of children. I would just say family members now taking care of children as their mothers go out to work. I think it's a very good thing in terms of culture, but there are many things that they need to improve on, especially looking around the issues around sanitation.
The foundation of every learning, of every investment in a country, it is supposed to be from the ground. That child needs education, needs health services, needs nutrition, needs protection, so that he grows or she grows in a holistic way.
Kajiado have a lot of space where most of their children can go maybe for a distance, a very far distance for their daycare centers or their ECD centers. Compared to Nairobi, Nairobi is a bit squeezed. Apart from private places which are very nice and can be learned from, you can get some ideas from them. But in the slum areas, it's a bit sanitation and so many other things which are not so much good.
Some of the concerns, particularly within the health for young children, is issues around nutrition. And this involves ensuring that they support the communities to be able to ensure there's exclusive breastfeeding because of the nutritional benefits that we know come with exclusive breastfeeding. There's also the question of immunization. We have immunization for children up to 2 years of age. So ensuring that the children have access and the caregivers are educated on the importance of these vaccinations and to ensure that they keep within the schedules.
The aspect of communal living is fading away. And the challenge that comes is that the element of child caring becomes a burden to the woman. Therefore, as social services, we come in terms of sensitizing the community, the mother, on the need of them continuing living as a communal society for them to be able to ease the burden of caregiving.
Children who are going to the ECD centers in public schools walk for long distances. They may not carry food, they may not carry any water. And these places are very hot and sandy, and children do not have shoes. When you ask parents, do you play with your children? They're like, play? What do you mean? They do not have the capacity to even make play materials using whatever is within them. So in terms of challenges facing the parents, they are there, but they may not even be aware because they do not understand that component, we are talking about holistic development.
It is always good to share knowledge, and also while you share, you get to learn. And at this point, now that we're coming up with our regulations, that we can still tweak here and there. So there's something also we are learning from Kajiado, even as they learn from us. And of course, they can't borrow the whole thing wholesome. They have to put it in their context. And we're not just sharing with Kajiado, because out of all the 47 counties, it's only Nairobi that had actually tried to come up with a childcare facilities act. And we have shared with all the other counties.
If it has to be sustainable, the parent must be ready to...
I think there is room for discussions around how do we create laws that are responsive to the needs of our children, that are responsive to the realities of the caregivers that we have now, even as we aspire to higher ideals, to higher standards. And I love the conversation around standards, because it then says that our children everywhere matter and they have the right to the best standard possible. But those standards need to then be differentiated. Are we talking about a situation where we are saying, if it's my grandmother who's traditionally taken care of the children in the home, how do we get the grandmother now to the level that we want? While from now moving forward, we are saying this is our standard. If you want to do this business, this is what you're going to have.
There is a place for people, for whoever is ready to help the community to get a good facility for these children, and even the community themselves. They have already realized the importance of children put in a place for security purposes and being engaged throughout the day while they also do other chores.
We are advising them to involve the community in terms of the molding, like art and craft, whatever our children are doing, so that the parent can be maybe engaged weekly, monthly, meeting, advocacy, so that they can understand better way of living and seeing how they can improve their kids.
There's parental engagement, parental awareness, so that they are also having a different attitude to the kid. We should also engage the male to also know that this kid need their loves, because what is most important to them is love.
What I would want to see is standards that are specific to children with disabilities, because there's a slight difference. We want the others, but you also need addition, simply because we need reasonable accommodation. So it's doable. And the beauty now is that we have a lot of goodwill, even politically, around issues of mainstreaming, and that's a good step.
We have very good political goodwill from His Excellency, the Governor of Kajiado County, His Excellency Joseph Lelenku. The other thing is that we have quite a very good supportive cultural and traditional practices in Kajiado County, especially for the care of the young children. One thing we will do is to actually map areas that we have challenges when it comes to childcare raising or childcare, childcare related problems, and make sure that we deploy teachers, ECD teachers, or even healthcare workers, or even establish more community units to be able to, bring a number of community health promoters to support the childcare facilities.
We have not had this kind of cross-county learning around children issues, but we've had cross-county learnings for community services, for waste management services. And so this in itself is a first in terms of looking at children care. And it's really important because we learn from them, they learn from us, and we are able to synergize and also form relationships because we border each other.
My hope is that childcare centers will be developed in Kajiado County. And it's my hope that all of them will have enough play materials. I also hope that the government will take it very positively and provide enough caregivers in these particular childcare centers.
We're implementing on evidence-based. We're not just waking up. Even when we talk to the men and tell them, based on these findings, we don't see you. And it's important that we see you. So for Kajiado, my expectation is that this will be embraced and that the partners here, the county government of Nairobi, will really give them like the first push.
When starting up childcare services in Kajiado, we only need to ensure that the given distance should not be really a big problem. It is how to locate the place where the center is that is very much important. Because again, the people, though the distance is from one homestead to another is quite far, but they are used to that movement. And parents can wake up a bit early and carry their own children to that particular point where the child care center is. It's applicable, it can be done very well. The only thing is that the people who will receive these young children should at least be people who can speak the language of the catchment area.
You cannot ignore the role of those old mamas or old women. They have a role to play, and you cannot ignore the mother-in-laws in terms of raising your children. So for me, the direction that we will have to go is to make sure that we approach it in a multi-sectoral manner, in key engagement of key community influencers, because they also have a role to play.
When you're introducing anything new, when it comes to behavior change communication, definitely you'd expect some resistance, but you need to use all other means just to work around it, to work with them and see how best, because we are encouraging them to adopt something which is very positive for their children.
Once we have such kind of facilities in all corners of the county, I think I'll have achieved some of my dreams. Now the remaining part is us to get a bill or an act to help us actually take care of our young kids.
We need everyone who is in contact with a child to be resourced, to have their capacity strengthened, to have their knowledge enhanced in how to take care of young children, so that in whatever context children find themselves in, they are sure to get that optimal care.
We are still seeking to understand what will work best for Kajiado County in regards to childcare services, because it is very difficult to prescribe a framework or a plan or a recommendation that works in Nairobi and then try to uproot it and plant it elsewhere. At times it might not really fit so well. And so the teams here are trying to understand what is working well in Nairobi and then see, is it adaptable in the Kajiado context.
The advantage that we also have to be able to support the childcare facility bill is that right now we also have a draft public health and sanitation bill. The public health and sanitation bill will ensure that our children are raised in a clean and safe environment. It will also support the childcare facility bill in a way, to strengthen the inspection of the childcare facilities in our communities. So when we work around that, we will be able definitely to put a lot of focus into making sure it is not just about a facility, but a good facility that will raise and ensure that our children are raised in a very good environment.
What I've seen with the Kajiado team, the stakeholders in Kajiado, they are very positive. They are interested in childcare, irrespective of the Department of Education, Department of Health, Department of Social Service, plus other departments are interested in this, and they are very positive, and they've really welcomed this. But I think they need more support. And my thinking here is to call on all stakeholders to support, especially in building this bill and also building childcare. The organizations that have been working there, providing food, providing all these other things. Now, can we sit down, all the stakeholders, to see how we can support? Especially the county government to build on some of these findings that we have had, because I think they are very good and they really point a positive trajectory for the development of the child, including their education.